peripheral nerve tumor. So, peripheral nerve tumors are the growth in or near the strands of tissue or nerves that transmit the signal from your brain to the rest of your body. These nerves control your muscles so that you can walk, blink, swallow, pick things up, and do other activities. So, the peripheral nerve tumors can occur anywhere in the body. Most of them are not cancerous, that is, they are not malignant, but they can lead to pain, nerve damage, and the loss of function in the affected area. The treatment of the peripheral nerve tumors usually involves surgery to remove the tumor. Sometimes the tumor cannot be removed without damaging nearby healthy tissue and nerves. In these cases, other treatments may be recommended. Several types of peripheral nerve tumors occur. These tumors affect the nerves by growing within them intraneural tumors or by processing against them extraneural tumors. While speaking about the types, one is acoustic neuroma, benign peripheral nerve tumor, desmoid tumor, malignant peripheral nerve sheath tumor, neurofibroma, neurofibromatosis, schwannoma. So, while speaking about the symptoms here, the symptoms and signs of the peripheral nerve tumor develop from direct effects on the main nerve or from the tumor pressing or nearby nerves. So, they also cause in the blood vessels or the tissues. As the tumor grows, it may be more likely to cause the signs and symptoms, although tumor size doesn't always determine its effects. The signs and symptoms of the peripheral nerve tumors vary depending on the location of the tumors and which the tissues are affected. They include swelling or a lump under your skin, pain, tingling or numbness, weakness or the loss of function in the affected area, dizziness or the loss of balance. Here we can look for the causes. It is not clear why most peripheral nerve tumors develop. Some are linked to non-inherited syndromes such as neurofibromatosis. That is, they are under type 1 and type 2 and they go with the schwannomatosis. Others may be caused by malfunctioning gene or triggered by the injury or the surgery. Here we can look for the risk factors. The peripheral nerve tumors are more common in the people who have neurofibromatosis and schwannomatosis. In these disorders, tumors develop on or near the nerves throughout the body. These tumors, which are frequently multiple, can lead to the variety of symptoms and the signs depending on their location. These tumors are usually cancerous. A history of a radiation treatment. If you were exposed to radiation, you are at the increased risk of peripheral nerve tumors years later. Here we can look for the complication. Both non-cancerous and the cancerous peripheral nerve tumors can compress the nerves. This leads to the complication, some of which may be permanent. Numbness and the weakness in the affected area, loss of function in the affected area, difficulties with balance and pain. While speaking about the diagnosis, to diagnose a peripheral nerve tumor, your doctor may ask you about the signs and symptoms, discuss your medical history and perform both the general physical and the neurological exam. He or she may order the several tests to help to pinpoint the cause of your signs and symptoms. Here we can use the magnetic resonance imaging. This scan uses a magnet and radio waves to produce a detailed 3D wave of your nerves and the surrounding tissues. While speaking about the computerized tomography, CT scanner, this rotates around your body to record a series of images. A computer uses the images to make a detailed view of your peripheral nerve tumor so that your doctor can evaluate how it may be affecting you. And next they go with the electromyogram. For this test, your doctor places a small needles in your muscle. So an electromyography instrument can record the electrical activity in your muscle as you try to move it. Nerve conduction study. You are likely to have this test along with your EMG. It measures how quickly your nerves carry the electrical signals to your muscles. While speaking about the tumor biopsy, if imaging tests identify a nerve tumor, your doctor may remove and analyze a small sample of cells from your tumor. Depending on the tumor size and the location, you may need the local or the general anesthesia during the biopsy. Sometimes this is the only way to determine whether the tumor is cancerous. While speaking about the nerve biopsy, if you have a condition such as progressive peripheral neuropathy or enlarged nerves that mimic the nerve tumors, your doctor may take a nerve biopsy. And next we can go with the treatment. Your peripheral nerve treatment depends on the type of tumor you have, what nerves and other tissues it affects, and your symptoms. Treatment options for peripheral nerve tumor include monitoring. Waiting and watching to see if the tumor grows may be an option if it is in a place that makes the removal difficult or if the tumor is small, slow growing and causes a few or no signs and symptoms. You will have the regular checkups and may undergo the CT or the MRI scan every few months to see if your tumor is growing. Surgery. You may need the surgery to remove the peripheral nerve tumor. The goal of surgery is to remove the entire tumor without damaging the nearby healthy tissue and nerves. When that isn't possible, a surgeons remove as much of the tumor as they can. New techniques and the instruments allow the neurosurgeon to reach the tumor that we were once considered inaccessible. The high-powered microscope used in the microsurgery make it easier to distinguish a tumor from the healthy tissue. Doctors also can monitor the function of a nerve during the surgery, which helps preserve the healthy tissue. Depending on the location and the size of the peripheral nerve tumor, surgeries can cause the nerve damage and the disability. These risks are often based on size and the location of the tumor and the surgical approach used. Some tumors grows back. Stereotactic radiosurgery. Your doctor may recommend the stereotactic radiosurgery to treat some peripheral nerve tumors in or around the brain. In stereotactic radiosurgery, such as gamma knife radiosurgery, doctors deliver the radiation precisely to a tumor without making an incision. Risk of radiosurgery include weakness or numbness in the treated area and the treatment failure. They continue the tumor growth. Very rarely, the radiation could cause a cancer in the treated area in the future. While speaking about the cancer treatment, malignant tumors are treated with the standard cancer therapies such as surgery, chemotherapy, and the radiation therapy. Early diagnosis and the treatment are the most important factors resulting in the good outcome. Tumors may recur after treatment. While speaking about the rehabilitation, after surgery, you may need the physical rehabilitation. Your doctor may use a brace or a splint to keep your arm or leg in a position that help you to heal. Physical therapist and the occupational therapist can help you recover function and the mobility lost due to the nerve damage or the limb amputation. Thank you.